Uterine vessels. Definition: Uterine vessels are part of the inversions and urine irrigation exactly in the ligaments. Ligament can be broad ligament, rogue ligament, and uterosacral ligament. Application in medicine. The fraction of the uterine vessels is irrigates enough blood to the placenta and fetus, but there are catheter vessels and uterine arteries and collage.
An uncomplicated diagnostic laparoscopy may take as little as 30 to 60 minutes. Your surgeon will gain access to the interior of your pelvis by using a sharp instrument called a trocar to make a small half-inch opening or port just below your navel or umbilicus. Carbon dioxide gas will then be pumped through this umbilical port to puff up your abdomen so its contents can be viewed more easily. Next, your surgeon will insert the laparoscope through the umbilical port. Images from its camera are projected onto a video monitor in the operating room. Your surgeon will carefully examine your pelvic organs and tissues, looking for signs of disease that might explain your symptoms. He or she may create other ports through which instruments can be slipped. These additional instruments are used to move organs out of the way for better viewing, or to perform operative procedures such as removing scar tissue, taking biopsies, or draining abnormal fluid.
Advantage: look around and diagnose the cause of any symptom. Repair or remove portions of barriers of fallopian. Surgical incision is more take of the open surgery. Disadvantage: breathing problems, damage to nearby organs and tissues, hair problems, infections.
What are adhesions? Adhesions are fibrous bands that can form between tissues and organs. They can cause abdominal and pelvic pain, bowel obstruction, and infertility in females. Adhesions, like the ones seen here between the omentum and abdominal wall, can be removed laparoscopically. What causes adhesions? Adhesions are the result of an inflammatory process caused by abdominal pathology such as diverticulosis or diverticulitis, and gynecological pathologies such as ovarian cysts. Common gynecological tumors that cause adhesions include endometriosis, ovarian dermoid cysts, and uterine fibroids. Procedures to remove gynecological pathology, such as hysterectomy, can also cause adhesions. However, adhesions caused by surgery can be prevented. This can be achieved by using minimally invasive surgical techniques such as robotic laparoscopy, the use of dissolvable sutures, and the placement of absorbable adhesion barriers such as interseed and seprafilm within the surgical field.
Diseases: uterine fibroids, sterility, cervical cancer, cervical polyps, preeclampsia, and eclamptic. It consisted of the aggravation of hypertension of pregnancy when it affects cerebral vasculature.
Preeclampsia, 7 symptoms every pregnant woman should know. If you're pregnant, you and your baby are at risk for a life-threatening condition called preeclampsia. Preeclampsia affects 1 of every 12 pregnancies and can cause seizures, stroke, and organ damage for mom and premature birth of the baby. Both mom and baby could die. Globally, preeclampsia and related disorders are responsible for 76,000 maternal and 500,000 infant deaths each year. This condition is related to blood pressure and can happen to any pregnant woman, especially during the second half of her pregnancy or up to 6 weeks after delivery. Preeclampsia can strike quickly, so it's important to know the symptoms and report them to your healthcare provider as soon as you notice them. If you experience any of the following symptoms, call your doctor or midwife right away. 1. Swelling of the face, especially around the eyes, and swelling of the hands. Swelling of the feet is more common in late pregnancy and probably not a sign of preeclampsia. 2. Weight gain of more than 5 pounds in 1 week. 3. Headache that won't go away, even after taking medication for pain relief. 4. Changes in vision like seeing spots or flashing lights, partial or total loss of eyesight. 5. Nausea or throwing up, especially suddenly after mid-pregnancy. Not the morning sickness that many women experience in early pregnancy. 6. Upper right belly pain, sometimes mistaken for indigestion or the flu. 7. Difficulty breathing, gasping, or panting. Having symptoms doesn't necessarily mean you have preeclampsia, but they are a cause for concern and require immediate medical evaluation. It is also important to know that some women with preeclampsia have no symptoms. The only way your doctor can diagnose it is by monitoring your blood pressure and protein in your urine, so keep up with all your prenatal appointments. Preeclampsia can also impact your long-term health. It's a risk factor for heart disease and stroke. Be sure to tell all your doctors, present and future, if you have a history of preeclampsia. Now that you know the symptoms, spread the word. Take the Preeclampsia Pledge. Know the symptoms, spread the word. Brought to you by the Preeclampsia Foundation. Learn more at www.preeclampsia.org. 321-421-6957. Follow us on Facebook, Twitter, Pinterest, and LinkedIn.